Thank you very much. So I've been waiting for this meeting for 20 years, actually. And first, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. As you probably heard, I always had very strong feelings about autism and how it happened and where it came from. I also, and we've already done this, we want no mercury in the vaccine. We want no aluminum in the vaccine. The MMR, I think, should be taken separately. This is based on what I feel. The mumps, measles period. Take it over 5 times or 4 times, but you take it in smaller doses. And
to meet the president's challenge, I ordered HHS to launch an unprecedented all-agency effort to identify all causes of autism, including toxic and pharmaceutical exposures. At President Trump's urging, NIH, FDA, CDC, and CMS are turning over every stone to identify the etiology of the autism epidemic and how patients and parents can prevent and reverse this alarming trend. Agencies, and we have fast-tracked research and guidance. Historically, NIH has...
Today, the FDA is taking action to update the label on acetaminophen and sending a letter to all U.S. doctors letting them know about the risks in pregnancy. We now have data we cannot ignore.
Environmental and medical factors, nutrition, events during pregnancy, in combination with biology.
Today, the FDA is filing a Federal Register notice to change the label on an exciting treatment called prescription leucovorin so that it can be available to children with autism. You know, autism may also be due to an autoimmune reaction to a folate receptor on the brain, not allowing that important vitamin to get into the brain cells.
Manner, we have a response today to the autism crisis. It is the first of several chapters, but
don't take Tylenol. There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol.
There's really nothing new that is coming out as of this new announcement. So most of the time when we make decisions and we make clinical decisions and we change our guidance and guidelines, it comes because there's new data that would support a change in policy. The data that exists today is the same data that existed a few months ago. And really, there's no new studies that have suggested anything to the contrary. The real concern we have is we know that autism and the spectrum disorders are multifaceted. They run in families. There's clearly a genetic component. And so to pin it all on a medication like acetaminophen is just hard to believe, primarily because there are so many reasons people take acetaminophen in pregnancy. So is it the acetaminophen, or was it the fact that the patient developed a fever from something else that led to the problem? Is it the fact that the patient has potentially maybe an autoimmune disorder that causes pain, and so they take acetaminophen for pain? Is there something else going on that results in a patient taking acetaminophen at a higher rate, which may be the actual reason for developing a spectrum disorder? So I think it's so hard to believe that something happened in the last few months since they announced they were going to study this that has changed the landscape of research so dramatically. And so for patients who have a child with a spectrum disorder, I don't want you going back and looking and saying to yourself, I shouldn't have done this, I shouldn't have done that. It's nothing you did. It really is not. And for patients who are pregnant now, who maybe took some acetaminophen early in pregnancy because they had a fever or they had another reason to take it, you needed to take that medication. Not taking it, not treating the fever, probably has more adverse effects that you need to worry about than taking the medication. So talk to your doctors if you have a concern. Go to them. We have overwhelming information from many, many years of data that suggests the safety and efficacy of acetaminophen for treatments during pregnancy.
Mr. President, on your autism announcement tomorrow, multiple news outlets are reporting that you plan to tie Tylenol to increase risk of autism. Can you confirm that?
Well, you're going to see tomorrow. We're going to do it tomorrow, but I think it's a very big factor. I think you'll see what it is tomorrow. We have various things, but you'll see what it is tomorrow. I think it's going to be a very important news conference. And we want things to take effect immediately. You know, if there's a question, even if there's a question, you just do it, right? But great research has been done. You know, if you think that, let's say 15 years ago, they had 1 in 10,000 that were born with autism. And now it's, think of it, 1 in 12, 1 in 10. Boys, 1 in 10 or 12. 2 different studies. Girls, it's 1 in 20. Can you imagine 1 in 20? And let's see, 22 years ago, it was 1 in 20,000. But it got down to 1 in 10,000 about 17 years ago, and now it's 1 in 12. Actually, boys are 1 in 12 and 1 in 10. I mean, can you imagine 1 in 10? And it was 1 in 20,000? So there's obviously something artificial that's really wrong. And we think we know what that is.
Are you planning to announce any link between vaccines and
What you see
autism?
tomorrow. Vaccines are very interesting. They can be great, but when you put the wrong stuff in them, and you know, children get these massive vaccines like you'd give to a horse. And I've said for a long time, I mean, this is no secret, spread them out over 5 years. Get 5 shots, small ones. You ever see what they give? They give, I mean, for a little baby to be injected with that much fluid, even beyond the actual ingredients, they have sometimes 80 different vaccines. It's crazy. It's, you know, that's a common sense thing. It's like you're shooting up a horse. You have a little body, a little baby, and you're pumping this big thing. It's a horrible thing. So I've always felt that. But we'll be having a big discussion tomorrow about autism.